Hi class, I'm going to do a quick little walkthrough for your Clinic 1A final. So you all have received the Clinic 1A final info sheet a little while ago, but this is helpful in helping to determine your qualifying patient for your final, right? Because during this final, this is going to be different than whenever you were in Clinic 1. In the spring, for this final, you are going to have qualifications that your patient needs to meet. The most notable thing is that clickable, discernible calculus. Okay, so your final info sheet is helpful. However, I recommend that you open, look at, and print out your clinic treatment selection worksheet. All right. So this is the paperwork that you are going to use the day of your final. Okay. So you're going to make sure that you have your patient's name on it. You have the exam date, your candidate number, which, ta-da, that is your student number. That's what your candidate number is. Then you are going to select the area that you plan to treat, right? So if you are treating a sextant, you are going to write down the number of the sextant or the 2 sextant numbers that you are treating. Same thing with quadrants. If you are treating 1 quadrant, you're going to have 1 number here. If you're treating 2 quadrants, you're going to have 2. You can also select an arch or a side. So that could be the upper arch, it could be the lower arch, it could be the right side, or it could be the left side. So you need to make sure that you have this portion filled out. This right here, examiner initials, you don't need to do anything with that. That is for your examiner. One of your instructors will be initialing that. So the next thing that you're going to want to make sure you do on the day of your exam before you let your examiner know you're ready for a check-in is you're going to select one of these categories. You're going to select category A, category B, or category C. You're going to check it, you're going to circle it, you're going to highlight it. You're going to make it obvious one way or the other that one of these categories is also what you are selecting, right? So up here, this specifies where you are submitting for your treatment selection. Down here lets us know which category you are looking at. It also gives you the requirements for each category. So if you select a sextant, which cannot be sextant 5, so if you select category A, you can select sextant 1, 2, 3, 4, or 6. You cannot select sextant 5. So you need to have a minimum of 4 teeth. 2 of those teeth have to be molars. You do not have to include third molars. We will talk about what you do with that if you don't, but you have to have at least 2 molars in that area. You have to have a minimum of 6 explorable detectable surfaces of supra or subgingival calculus. Then for category B, this is if you are doing a quadrant or one quadrant. You have to have, again, a minimum of 6 teeth in this area, right? The sextant is a minimum of 4 teeth. A quadrant has to have a minimum of 6 teeth in it. You need to have 3 posterior teeth in that quadrant, and 3 of those posterior teeth have to be molars, right? So this takes into account that some people have their premolars, 1 premolar extracted. So even if they are missing a premolar, they would still qualify. You have to have a minimum of 6 explorer detectable surfaces of supra or subgingival calculus. So then category C is if you are doing 2 sextants or 2 quadrants with a minimum of 12 teeth. You must have 4 posterior teeth within these 2 sextants or quadrants and you must have at least 2 molars present. And again, you need a minimum of 6 explorable detectable surfaces of supra or subgingival calculus. Now, you can also pull, if you are selecting one of these categories and you do not have 6 deposits of calculus present in a sextant, a quadrant, or in 2 sextants or 2 quadrants, you can pull up to 2 teeth outside of your treatment selection to obtain the 6 minimum deposits. Now you still have to meet these requirements, but you can add up to 2 teeth outside of your treatment selection. So say you selected sextant 6. You write sextant 6 down, but you don't have enough calculus. You don't have 6 deposits of calculus in that sextant. So you could select 2 teeth outside of that treatment selection. You could select, maybe you have 4 deposits and you need 2 more at least. You could select the canine of number 27 if it had 3 deposits on it. All right? But when you do that, you need to make sure that you follow the directions down here and that you let us know that you also are selecting an additional tooth. Or maybe you're doing sextant 6 down here and you're going to select number 2 to get your deposits, right? So there is a little bit of wiggle room. Ideally, you are treating a category A or a category B. Those are ideal scenarios without having to add any deposits. Now, the next part that we need to make sure of is that you have a minimum of 6 surfaces of explorable detectable supra or subgingival calculus on the teeth selected for treatment. You can only have a maximum of 4 of the 6 deposits on mandibular incisors. So that would mean that you would need to have 2 deposits somewhere else. Now, these mandibular incisors could have more than 4 deposits on them, and that is okay. You are going to calculus detect those. However, you need to make sure that you have 2 deposits somewhere else that count. So remember, it's a minimum of 6 surfaces of detectable calculus. A minimum. So your area could have more than 6 deposits, and that is okay. But whenever we are looking at qualifications, you can't say I'm treating, quad 4, and you're going to do 25, 26, 27, 28, 29, 30, and 31. You cannot only have calculus present on 25 and 26. Because if you had calculus present on the mesial, lingual, distal, that's 6 deposits right there. But you could only count 4 of those 6. So you need to make sure that you had 2 more deposits somewhere else in this area. Now, when you are calculus detecting, because you see this important right here, calculus detection, you are going to use this grid down here, just like you do with your calculus detect sheet. You're going to transfer your calculus detect information for only the teeth that are in your treatment selection. So if you say again that you are doing quad 4, and we're going to mark out 32, we're going to assume they don't have it, or I don't want to count 32 because it's difficult and I don't have to. I can exclude the wisdom teeth. I am going to calculus detect all discernible, detectable calculus that I feel in this entire quadrant. If I have 6 or 8 deposits on 25 and 26, I am going to calculus detect all of those. Even though I know I need to make sure that I have at least 2 back here somewhere that are not on incisors. So I could have, you could have double, at least even triple the amount of calculus that you need. That may not be your best option for a patient. Patient selection matters, but you can have far more calculus than 6 deposits, but you need at least 6 deposits of calculus present in your treatment selection area, right? Now, if you need clarification on that, always reach out to me or one of your other instructors, okay? But that is how this treatment selection worksheet works. Now, when you are using this worksheet the day of, you can fill this out ahead of time if you would like. You are welcome to do that. I would also have another one just in case, and we'll make sure we have plenty for everyone the day of the exam. This paper cannot get contaminated. So when you are doing your calculus detection, I strongly recommend that you do your calculus detection on your erasable sheet, your laminated sheet, and then you are going to transfer it over with a clean pen and hand onto this paper. And this paper will remain on your second shelf of your cart. Right? So now let's go back. So we've gone over that treatment selection worksheet. The other thing that is now visible to you is your final exam itself and time instructions. So your time instructions here is going to give you the time makeup. And it breaks down a checklist of things that you need to do. The important times to consider is that if you have a morning final exam, you need to be ready to walk into the clinic at 7:45. So you should be lined up at reception area before 7:45 with your things ready to go back. You need to seat your patient at 8:30. So I recommend you tell your patient to come sooner than 8:30, because if your patient is not seated at 8:30, you will lose a point for time management. You will also lose a point if you are not ready to walk into the clinic at 7:45. If your patient is late, though, you will lose a point on time management. So make sure your patient is there early. Then I want you to review these things to make sure that prior to check-in, you make sure that you have done these things and that you understand what is accepted of you. Check-in is pretty much the same as any other day in check-in. The only difference is that you're going to use this treatment selection worksheet, right, that's going to let your instructor know what you are doing. So review this sheet closely. Then you must check in by 9:30 in the morning if you are a morning appointment. If you are late, you will lose a point on time management. You're going to notify your evaluator that you are ready for check-in. You've got all these things completed up here. You're going to let your instructor know, your evaluator, that you are ready for check-in, and then you are going to walk to the waiting room and wait. Your evaluator will then come get you and inform you if your patient qualified. If your patient does not qualify, the most likely outcome is that you will be instructed to complete a full mouth debridement. However, the patient's best interest is always taken into consideration, and if myself and the evaluator do not feel that a full mouth debridement is the best step forward in treatment for that patient, we will inform you of the specific area that you will be completing your treatment. However, you will lose a significant amount of points, and most likely you will be debriding a much larger area than a sextant or a quadrant. Then you're going to proceed with your treatment. At 11 o'clock, you need to be ready for checkout. This includes all of your notes, your services rendered, your ledger, and referrals. Do not apply fluoride before your checkout. That will be completed afterwards. Again, you're going to notify your evaluator that you're ready for checkout, and then you're going to walk to the waiting room, and then your evaluator will inform you when checkout is complete. You're going to apply your fluoride varnish and dismiss your patient. You will return back, and you will clean up your chair, take your instruments to sterilization, and all of the things that you normally do. The afternoon exam is the same. However, your time is going to be slightly different. So you will arrive and be ready to walk into the clinic at noon. Then you will seat your patient at 12:45. Then you will be checked in and you will be ready for check-in at 1:45, and you will be ready for checkout at 3:15. You have a minimum passing score on this exam overall is a 75%. You have an instrumentation portion that you must pass at a 65% or higher. Otherwise, you have to retake the instrumentation portion. You also must pass your your calculus detection portion at a 75%. Otherwise, you will redo a calculus detection and have to prove competency in that. So I also recommend that before your final, you review, you print out whatever works best for you, and you look at the final exam. You have access to this for a reason, so that you see what's expected of you. Ideally, your patient that you see for your final is a patient that you've been able to see prior, so that you don't have to worry about doing x-rays. You've seen this patient before, and you've gotten to spend some time with them. However, that doesn't always happen, and that is okay. However, if you haven't seen that patient before, you are going to need to do the appropriate x-rays that are important for the patient, do your probing, and do your dental charting. However, if you have not seen this patient before, you are only going to probe and dental chart the area that you have treatment selected. So that helps you some with your time constraints. But again, ideally, you've at least looked in this patient's mouth before. Now, if you have seen this patient before, you are not allowed to copy and paste extra intraoral information from previous appointments. You can review it, but you are not allowed to copy and paste. For your treatment selection, these areas are good to review so that you understand how you're being graded on those. Here is your calculus detection. Again, we will verify just like we do whenever you do calc detect competency. It is the same exact process. If you are less than 75% in competency for your calc detection, then you will have to prove competency on that portion at a later time. But again, it is important that you review these things and make sure that you understand the points that are present and the things that you could lose silly points on. Patient education is often one that is missed. So that is just an example of silly things that you can miss on. Now, you will notice your instrumentation portion. This area, if you receive a less than 65%, it is a critical failure of this section only. However, it could cause you to fail the entire exam, which you will then have to retake. If you only receive a critical failure in instrumentation, then you will need to retake this portion and prove competency in your instrumentation. So make sure that you are evaluating and looking at what your evaluator is going to be looking at. The one thing I want to make sure that you are aware of too, though, is that You can self-correct at any point, and you do not need to voice that to your instructor. If you pick up the wrong instrument and you start debriding, don't keep going when you realize it's not the correct instrument or that you are not adapted the way you want to. Work and provide your treatment, implement your treatment, do your instrumentation as if your instructor is not watching you, right? If you pick something up and it doesn't make sense and you need to readjust, then readjust, okay? If your ergonomics feel wrong, adjust. If you are feeling really out of sorts and you are feeling like you're just can't get out of a funk while you're taking your exam, voice to your instructor that you just need to step out of the room for a second. Step out, walk in the hallway, and come back. A lot of times, just simply getting up, washing your hands with cold water, and sitting back down can make a world of a difference, especially when you're taking an exam and you may feel stressed because someone's watching you. You feel like there's a lot of pressure. So if you need to walk away for a little bit, walk away. All right? And we get it. We do it ourselves whenever we are seeing patients sometimes. So again, review everything. Make sure you're looking at the grading criteria. Do not stress about this though. Really, you are doing the things that you do every day in clinic, right? You have been tested on and scrutinized on all of these things multiple times in clinic already. We're just doing a comprehensive exam of it. So this area 2 under management of care is under your scaling and calculus deposit removal in the treatment area. The evaluator is going to select 6 clickable deposits. So like it could be number 2 mesial and 3 distal and 4 mesial and 7 distal and, 8 lingual, something random like that. We're going to select 6 clickable deposits that we will evaluate at the end of your exam. And you have 1 point for each. So if you removed it, you get a point. If you didn't remove it, you don't get a point. You need to use local anesthesia as appropriate, and make sure you have your local anesthesia forms ready for your evaluator. This is one thing, anesthesia, you can do grad requirements on. You're going to do appropriate needs for extrinsic stain. You just need to make sure that all the stain and any plaque and supracalculus are gone. You're going to use fluoride as indicated, and then we're also going to grade you on tissue management, right? So if you're adapted well and you are using your ultrasonic and your instruments appropriately, then we should be fine on tissue management. This lower portion is your time management. So for each of those time constraints that I mentioned during your time areas, you are graded on 4 of these, all right? On your arrival time and being ready, your patient seat time, your check-in, and your check-out. So this exam is a total of 81 points. You must receive a minimum of 61 points to pass. If your patient is a non-qualifying patient, if you do not have a treatment selection that qualifies, you will have a maximum of 10 points deducted for that. However, it is much more difficult then to maintain other points. Time management points often can be lost. You can also, your treatment selection area that you complete is going to be much larger. Your evaluator will be then selecting tooth numbers and surfaces from anywhere that you are required to debride. So if you have a poor treatment selection and your patient does not qualify, it can be much more challenging to meet all of the requirements, right? Because you are going to have to go back and periochart the entire area that you are required to treat. You are going to have to make sure that you dental chart the entire area. So if you go from thinking you are going to treat a quadrant or a sextant and now you have a full mouth, you're going to have to go back and update those items, right? You're going to have to make sure that you remove all the stain and plaque and things from the entire mouth. So review your treatment selection plan, right? And again, if you have questions on that, come talk with me, talk with any of your other instructors. They are happy to help make sense of that. It can be a little overwhelming whenever you have your first final clinical exam that has requirements in it. And you're all going to do great. And remember, if the exam doesn't go well and you happen to not meet the requirement, we're going to retest. We're going to reteach and we're going to retest, right? So if that happens, we're going to make it good. We're going to make it right. But just remember too, you have done all of these things in clinic already. You've done all of these things multiple times for hours on end in clinic. What can be challenging about finals is that you have a shorter window of time. So have a plan, be ready, and review your material ahead of time so that you can ask questions before the exam is here.